So, would you just mind confirming your name and date of birth for me? Excellent, thank you. My name is Dr. Calliope, and I'm going to be examining you today. Is there any particular reason why you wanted to have this exam? Okay, just a general examination then. Alright, wonderful. So, are you comfortable? Okay, we'll be here for a little bit, so let me know if there is anything I can do to make you more comfortable. I would love to start by taking a look at your hands, if you don't mind. There are a few particular things that I'm looking for. So, we're going to start with your hands palm side down. And there are quite a few things we can look at here. One of our more important spots is going to be the nails here. So, we can tell a lot about the health of a person by their nails, by the coloring, if there are any little nodules around the nails, if there are any little buildups here, the condition of the nail. Now, as you can see here, my nails are pretty clear, save for the bits of dry skin there, but it is winter. And then we have things like the capillary refill. So if you press down on the nail and surrounding skin should blanch, turns that pale color. And then when I take my hand away, then we see that color return. And that should occur in less than 2 seconds. Right there. We'll do that for all your nails. We look at the color. We look at the joints. We look at temperature as well. And then if we look at the palmar side of the hand, then we can look at the thenar and the hypothenar muscles, for example. We can look at palmar thickening. We can look at the color of the skin here. Is it clammy? Is it dry? So if I could just look at yours then. You could show me the backs of your hands. Okay. Good. Nails look good. Capillary refill. Each of the fingers looks good. And if you could flip your hands over, I can look at the palmar side here. Excellent. All right. So I am going to have you hold your hands out straight like this. And that's going to show me if you have any sort of tremor at all. So if you could just keep your hands out and try to keep them from moving. As you can see, mine don't really listen to me very well. If you could just do that. Okay. Wonderful. Now I'm going to have you stay like that. But this time, cock your wrists back like this. Just go ahead and bring your hands up. Okay, we're going to stay like this for a moment. We're looking for what's called a flapping tremor, which your hands will start moving around like that without you trying. Okay, good. Go ahead and put your arms down. So now I'm going to be taking some pulses here. I'm going to be working with the radial pulse on both sides here. The radial pulse is going to be right in this area. So you have your thumb here, the crease of the wrist, And then right in here, we have the radial artery. So it's very easy to feel with 2 fingers here. But I'm going to be taking 3 fingers, pressing in, maybe adjusting a little bit, and then I can feel a good strong pulse right in this area. We'll be measuring that. We'll be measuring the rhythm, the speed, and the strength to assess the quality. So I'm going to put my fingers on your wrists here at the radial artery, and we'll just hang out for a little bit. Got any cool plans for the weekend? No, not here. We've had a bit of excitement, lots of family gatherings and the whatnot. And when family gatherings generally consist of 10 people at a time, you kind of need the following weekend to just hang out. Alright. Good. Okay, so heart rate looks good, and also got 12 respirations per minute there. Excellent. Now let's go ahead and look at your brachial pulse here. Our brachial pulse is going to be felt in this area right here in the cubital fossa. This is the crook of your elbow. And you can feel it right in here, right in this area. I'm just going to press down and make sure that it's present and assess its quality. Okay, I'm just going to come in the crook of your elbow here. This one can be a little, there we go. Just takes a bit of finagling. Here. And the other side here. Good. And that is present and strong as well. So let's go ahead and take a peek at your eyes. Got a few instruments over here, so let me see. There we go. Give my flashlight a second to warm up, and while that's doing that, I'm just going to come a little bit closer here if you don't mind, and I just want to take a look at your eyes here. Have you noticed any itchiness, wateriness, change in vision, blurred vision, doubling, redness, irritation, any of those little bits and bobs with your eyes? Okay. Have they been feeling quite tired or strained at all lately? Okay. Good. So let's take a little peek here. I'm going to have you look at my nose. We're just going to bring this up, get a little closer, bring it up, get a little closer, bring it down. Okay. Good. Alrighty, so pupils are equal in size. They are round in shape. They are reactive to the light. Okay. If I could just have you look at the light shade behind me. Just do your best to keep looking at that. Good. let's take a peek at your conjunctival tissue. I am going to pull down on the eyelids. I'd like you to look up for me. Okay, I'm just going to pull down. You look up. Good. And go ahead and look down. I'm going to pull up. So pulling up, you look down. Look down. Good. Down, down. Excellent. So, not overly red, not pale, just right. So, if I could have you just take a look at my fingers right here. Just keep your eyes focused on my fingers here. I'm going to have you follow them around. And I want you to use only your eyes. Don't move your head at all. Now, look at my fingers here. And we're just going to bring them around your vision, different directions. Just keep following them best as you can. Good. Good. Okay, we're going to get a little quicker. Change it up a bit. Keep following my fingers. Good. Little faster yet. Doing this with my non-dominant hand if it looks a little shaky. Okay, just keep going and faster yet. Can you follow my fingers around? Good, we'll slow it down. Just follow them in and out. Good. Best as you can. Just track them. Good. Okay, can you look at the lampshade right here? And can you look at my fingers over here? Good. Can you look at the wall? And then my fingers right here. Good. Can you look at the white shelf? And then my fingers right here. Okay, follow my fingers in and out. In and out. There we go. And if you could look at this little knob right here. Just take a peek at the knob. If you were British, that'd be a little more awkward. And look right here. And follow my fingers in. There, and out. And in, and out. Okay, it looks pretty good. So, why don't we go ahead and take a peek at your nose and your sinuses. Let me grab the otoscope here. So we are going to have to put this bad boy together. I'm just going to attach the head here to the base of the otoscope. Make sure that the light comes on. This is our speculum here. It's got a little tab on the inside so that it fits right in here. It snaps in there. And make sure that we've got some good light there. So with this, I'm going to have you tip your head back and I'm going to get real close here. Do you mind? I just lean right here. Inside the nasal passage there. And we'll look at the eyelids look good. Nothing looks swollen. Okay. Have you been having any issue with runny noses at all? Bloody noses? With dryness, congestion, anything of that sort with the nose? Okay. I am going to occlude one side of the nose. I'm going to hold it shut. I'm going to have you take a couple breaths through the open nasal passage. We'll just make sure that everything looks good there. So I'm going to take my fingers here. Just press them there. Is this comfortable? Okay. If I could have you take an inhale and exhale. Good. Inhale and exhale. Okay. Other side. Inhale. Exhale. Inhale. Exhale. Did you experience any sort of difficulty at all with that? It didn't sound like there was any, but I just want to make sure. Okay. All right, good. So for your sinuses, I'm going to be pressing in on them and also doing a little bit of tapping. So we're going to start right here at the forehead. I'm going to give this a good press. Release, press, release, press, release. Just do that a couple of times all over the frontal sinus area. Okay, how was that? All right, and how about right here? Release, press, release, press, release, right along the ethmoid sinus area. Anything there? Okay. How about right here? Any pain or tenderness in the maxillary sinus area? Anything there? No. Okay. Now I'm going to do a little bit of tapping here. So in those same areas, I'll just start right here. I'm just going to do this little tapping bit. All good? Okay. Right here. Okay. And right here. How about that? Alright, everything seems normal. Good. Excellent. Let's see what else we've got. We've done the hands, looked at the arms, the eyes, the nose, and the sinuses. Let's move on to the oral examination. Now, where do I have my tongue depressor there? And then let's bring in, we'll just use the otoscope without the speculum there. If I could have you show me your teeth. Just want to look at the teeth here. Okay, good. And if you could open your mouth and show me your tongue. Okay. Right. Can you lift your tongue to the roof of your mouth? Just going to hold this here. Okay, Okay, good color. Nothing going on the floor of the mouth. Can you move your tongue from one side, the other, up and down? Okay, can you stick it out as far as you can? We're going to look at your throat here once I've got my little light to help me see. There we go. Okay. There. Now just relax the tongue. And let's see. Okay, pharynx wall looks good. And if you could say ah for me. Excellent. Very easy cranial nerve test that. Check the uvula, and it is symmetrical. It is midline. Okay. So let's just take that out. Excellent. So that all looks good. Now let's take a peek at your ears. For that, I'm going to need a new speculum. And then we are just going to put in the otoscope and take a little look around. Let's start right over here. There we go. And it looks like the ear is pretty clear. The tympanic membrane is in good coloring, and there's no perforation. See, so I got my little landmarks there. Cone of light, tip of the malleus. Alright. Just go ahead and pull that out. And then on the other side as well. Now have you lean forward for me. There we go. And then I can just come over here. Good. Alright, so we have the ear canal, tympanic membrane, tip of the malleus, the cone of light, no perforation, no bulging, no sign of infection, irritation. Okay, excellent. So, there we go. Very good. And then we have our blood pressure cuff here. So we are going to measure your blood pressure, make sure that is all good. So let's go ahead and get you situated. This is going to go on your upper arm. Got a little bit of Velcro here to make sure it's nice and tight. And then we're going to clip this little dial here onto the cuff. So it's got a little clip here that we can just hold on there. And then we have our measurements. And this is our little bulb that inflates the cuff. If we undo the dial here, then we can let air out of the cuff. And if we close it up, then it keeps the air in. I'm going to start by using the sphygmomanometer and just having my fingers on your pulse. And then we are going to bring in the stethoscope, and I will be putting it in the crook of your elbow here. so that I can listen to the sounds in the artery, so I can get a correct measurement. We'll go ahead and start with my fingers on your radial pulse here. And I can't feel the pulse anymore. Right, and we'll let the air out. We will take the stethoscope, put this in the crook of your elbow here, and we will do that once more. Let's make sure the valve is closed. There we go. Okay. There we go. Good. Right. Okay. And all the way. Good. Okay. Let's just this right here for a moment, and we'll get you undone. Take off the dial and the cuff. Okay. And let's grab, let's see, I've got my oxygen saturation meter right over here. And the temperature. So, if I could just have you hold out a finger. We're going to attach this on there, this little clip. Okay. And for your temperature, I'm going to have you open your mouth and lift your tongue to the roof of your mouth. There we go. And I'm going to put the probe right underneath the tongue. If you could just lay that on top of your tongue, or lay your tongue on top of the probe, rather. My gosh, must be getting late in the day. Okay, let's see. Good. We have 98.4. Let's see, oxygen saturation is 99. Wonderful. And let's go ahead and check your lymph nodes. So I'm going to have you turn around, and I'm going to feel along the neck, underneath the jaw, around the ears, and the back of your head. We're going to feel for many of the lymph nodes in this area. See if any of them are distended at all. Okay? Let's go ahead and start underneath the jaw. Okay. Good. And around the ears, preauricular and postauricular here. Okay. And for the back of the head, I'm just going to hold you still. We'll feel for the occipital nodes here. Okay. Good. Right. And then I'm going to come down into the neck here. Okay, anterior cervical, posterior cervical. And if you could swallow for me, I just want to assess the thyroid. Just like that. Okay, very good. So now I'm going to have you just give your shoulders a couple of shrugs, if you will. Good. I'm going to press down on your shoulders. I'd like you to press up against me. Very good. I'm going to try to press down. You keep pressing up against me. Good. Excellent. So good strength there. Now, while you are sitting facing away from me, I'd like to take a listen to your back. So we're going to listen across different lung fields here. So if I could have you take a deep breath in here and out. Deep breath in and out. Deep breath in. Deep breath in. Out. And out. Deep breath in and out. Last one, deep breath in and out. I'm going to have you flip around in a second, but I just want to palpate the low back here, sacrum, for any edema, if there's any swelling here. Okay, that feels good. So I'm going to have you flip around and face me. We're going to listen to your lungs, your heart, and your abdomen, right? Okay, so same as before. Deep breath in and out. Deep breath in and out. You're doing really well. Deep breath in, out. Deep breath in, out. Deep breath in, out. Deep breath in and out. Deep breath in. Let's take a little listen to your heart. So we will start right up here at the aortic valve. Okay, pulmonary. Down to tricuspid. And over to mitral. Excellent. So let's go ahead and take a listen to your abdomen here. keep breathing normally. Okay. If you don't mind, I'd like to have a little feel of your abdomen. I'm going to start with one hand, okay? We're going to feel for tenderness, feel for the liver, spleen, kidneys. Good, and now I'm going to use both hands, and we're going to be real quick about this. Not the most comfortable thing in the world, I know. Deep breath in, and out. Deep breath in, and out. So let's go ahead and look at your legs here. I'm just going to move the drapery. Bring this right here, that's okay. Take a little peek. And I'm just going to move legs. You had any pain in your legs at all? Okay. Skin looks good, so I'm going to check for any edema in the ankles, pedal edema. Okay, and how about our pulses? Post-hip, dorsalis pedis here. Let me see. Oh, here we go. We've got the Queen Square reflex hammer. So the Queen Square reflex hammer here has two parts. We've got a little stick, and we have our striker. We're just going to twist that in, and then we have our put together Queen Square. So we're going to get the reflexes at your knee, the biceps reflex, as well as the triceps on the back of the arm. Go ahead and move your leg here. And we're going to do a few taps. Good. Bring this back down. And if I could have you just place your arm down, palm side up. Okay. We'll get the biceps reflex here. I'm going to put my hand around your arm. Good. And then I'm going to have you just put your arm across your thighs. I'm going to get behind your arm here. Good. And other side. Have you lay your arm palm up. Good. And lay it across your thighs. I'll come get the back of the arm here for the triceps reflex. take this baby apart again. All right, so just fix the drape here if you don't mind. Just don't want it to be all bunched. There we go. So that is going to conclude our examination. I didn't find anything out of the ordinary at all. Did you have any questions for me? Any questions about what we looked at? Okay, wonderful. So let's grab my pen and my clipboard. Let's see, nose, sinuses, teeth, mouth, throat, tongue, ears, BP. We had 80 millimeters of mercury there. 98.4, I remember, and O2 stats. 99%. Lymph nodes, shoulder, the cranial nerve, good. The heart, the lungs, legs, reflexes, pulses. Okay, I'm going to go ahead and sign off on this. There we go. And we can go ahead and put that back in our little holder. Thank you so much for allowing me to perform this examination. You were a wonderful patient. I hope you have a whale of a day and a good rest of your night.